Colleen Kiley. I'm the registered dietitian and diabetes educator here at Anne Arundel Medical Center, and today we're going to show you how to inject insulin using an insulin pen. So once you've tested your blood sugar and you know how much insulin you're going to give, the first step is you want to wash your hands. You can use either soap and water or you can use a hand sanitizer and just make sure it's rubbed in really well. Then you'll want to get your alcohol swab and you will want to clean your skin. And for today we're going to just pretend that this is your skin. So you would inject into there and you'll clean the top of your pen with the alcohol swab. Then you'll take your pen needle and you'll remove the colored cap. And you can see part of the needle is there already. You need to make sure that you place it straight directly onto the pen. If that needle bends, you will not get any of the insulin, so you have to make sure it's placed correctly. You twist the needles once you feel that it's tight. You remove the clear outer shield, and then you remove the green inner shield, and then you can see the needle there. You'll dial up to 2 units, or when you hear 2 clicks, and you will hold the pen straight up, and this is to do the air shot. And you do this every time before an insulin injection to make sure that there's no air in here between the needle and the insulin. So you push until you see droplets of insulin come out. Push so it winds all the way down to 0. If you don't see insulin coming out of the needle at the top, you're going to go ahead and do the 2-unit air shot again. If you see the insulin, then you know you're good to go ahead and dial up your dose. So for this purpose, we'll say we're going to give 10 units. So you dial up till the little marker is pointing to the 10, and then you'll grip the pen with your 4 fingers around and the thumb on top. And it's easier to have the window facing you when you go to inject, so you know once it's all delivered. You go straight in at a 90-degree angle and push the top of the pen, and as it winds down to 0, then you hold it in there for 10 seconds. So you can count up from 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then you remove the pen straight from the site. Recover with just the clear shield and twist off the pen needle. You do not want to leave your pen needle on your pen because that introduces air to the line, or air to your pen. You recap it with the pen cover, and then you dispose your pen needle into your sharps container. Your sharps container can be one from the drugstore, or it can be a laundry detergent bottle, a coffee can, a Gatorade bottle, something that's not going to be punctured. And then in the state of Maryland, you can always just close the cap on that and tape it and then write sharps on it, and it can go in your regular trash. So just some other things about insulin. When you inject, you can inject anywhere on the back of the arm, around the belly, or the outer thigh. And you always want to rotate to a new injection site each time. Each time you have an injection, you want to make sure you're using a new pen needle. And you want to make sure that you always keep your insulin pen that you're currently using out on the counter and your extra pens in the fridge. The pen that's out on the counter can last for 28 days. If you still have insulin left after 28 days, you want to go ahead and throw that pen away because insulin does expire. And then you can grab a new pen from your fridge.